Good afternoon, everybody. It's Wednesday. I'm Kelly Baltzell. I'm the CEO of Beyond Indigo Pets. It's Wednesday. That's a Dr. Jess Trimble day. Welcome, Jess. Welcome back.
Hi, thanks.
So we have kind of, I think the word pivot is getting a little overused, but we have meandered into another channel of kind of augmentation of our topics for Wednesday, right? Or sauntered. And saunter is a nice word. Saunter is a good word. And easy to spell too, so that's a bonus. So when you're dyslexic, you got to take it where you got it. So we're sauntering over into some technology today and discussion because there's so much out there. What's going on?
Yeah, we briefly mentioned it last week, sort of the world of augmented and virtual reality. And so, of course, I wanted to dive into it this week. This is something I'm really excited about because it has just unlimited applications. But it's also one of those things that, as all things augmented and virtual, they're not tangible. They're pretty hard to actually imagine how it can affect your life in so many ways. And so we'll start off first with sort of some definitions. So augmented reality is literally the enhancement of your current reality. You may be looking through your phone, seeing your room, but suddenly there's something else in that room with you. Like Pokemon Go is a perfect example of augmented reality. It's your own environment, just with a little something added in. And that can be sights, sounds, smells, even feelings in some instances. Whereas virtual reality is going to be more of a complete immersion experience. They're going to pop you into a reality that is entirely not your own. Often, though, you can combine the two together and they play together really nicely. And so right now there's actually a fair number of manufacturing companies that are using augmented reality for like quality assurance. If the person who's checking the object to ensure that it came off the line perfectly can see, just hovering there, what a perfect example looks like, suddenly they're able to do their job much, much more efficiently. And IKEA actually uses augmented reality to help you see their furniture in your own room. So there's definitely a lot of applications, and it's being used pretty heavily right now in a variety of different places. But obviously, for me, what's most interesting is how we can apply this to the veterinary space or the medical space specifically. So to start with, let's actually switch to the next slide here because I want to start talking about these a little bit. These are two companies that I think are just fantastic. They do some really cool stuff. And we'll kind of go into what each of these companies does. But both of these, in their own separate way, are helping with improving education, both at very basic levels, for kindergartners, all the way up to board certified surgeons teaching other doctors how to do a surgery, or even guide them through the surgery themselves when they're in the moment and doing it. Both of these can also be used. And when I say both, one of these companies is augmented reality and the other is virtual reality. But both can be used then for surgical planning, for education, for those receiving the surgery. So, for instance, having the ability to actually show somebody their own brain with, perhaps the area of the tumor and what will happen when that tumor is taken out. You better believe that they're going to have a far better understanding of what's happening to them when it's actually virtually in their hands and they can see it. So for us to be able to educate our clients, to educate our young veterinary students, to educate even our colleagues, these technologies are going to be absolutely incredible, and they're really accelerating quickly on their improvements. So a couple companies other than these that I think are also really cool. There's one called X Vision, and what they're doing is they're using augmented reality with people's actual MRIs and CT scans. And so, say someone's lying on a surgery table, that then can sort of overlay what the person's insides look like from that MRI or CT. So the surgeon can see exactly where the lesion or whatever it is that they're trying to surgerize is on that person. And so they did some really interesting studies with the placement of screws into a spine. And you can imagine how absolutely critically accurate a screw going into a spine must be. And so they did a few different studies, but in the main one, they were comparing a human putting a screw into a spine as normal, and then a human putting a screw into a spine where he had an augmented spine, that patient's actual spine, sort of hovering over, so we could see exactly where he was. And they found that there was over 98% accuracy when using the augmented reality, which was far better than the human placement. That's all they said in the study, was far better. They didn't tell us how accurate the humans actually were, but they did say that it was significantly improved. So that is one step. Otherwise, there's a company called Vicarious Surgical, and they're actually using the virtual reality, like this last company was, combining it with some machine learning so that they can sort of learn from their mistakes. And then they're using surgical robots. And so really there's not even a human touching it at this point. It's all done using virtual reality and surgical robots, which is a little terrifying and also super cool. So if you want to skip to the next slide, we're going to talk about Zapper first. Zapper, I think, is so cool because it's so easily accessible. And what this is basically augmented reality for the common person. So there's actually a free month trial. You can go in and play with it yourself. And what it does is it allows you to upload your own images or data or videos to put into an augmented reality setting. And I stumbled across this first at the Veterinary Innovation Summit 2 or 3 years ago. And what they had done is they had taken the CT scan of a patient's heart. And so you could see every little vessel, artery, vein, and just with a quick scan with this app, I suddenly had this heart in front of me. I could turn my camera, I could see all parts of this heart. And so these pictures here are examples of that I found. BBC actually provides these. They've got a heart, a brain, and a liver, and it allows you to, once you scan it, have this heart directly in front of you. And you can see this heart is hovering over my computer, but the heart is actually beating in front of you. You can hear it. You can click on those little dots there, and it will tell you what the valve is or that piece of anatomy or what the pathology is going on there in that unhealthy heart. And so if it took me approximately 15 seconds to download this and find this heart, you can imagine how valuable this is going to be for teaching anybody. You know, students as young as third or fourth grade could probably get a ton of value out of this, let alone a medical student who's actually needing to memorize the anatomy here. So this is really going to democratize our access to knowing about our own bodies and being able to see all parts of a heart without actually having to hold a real heart in your hands. So Zapper is a super cool, and I know there's some veterinary schools that are starting to use that in similar manners for teaching their students. And then if we want to go to the next one, Pixas, and this picture is kind of hard to really see what you're looking at. But what Pixas has done is they've created something called Exerobet. And so they had a surgeon wear their sort of special VR filming, whatever it is, and do a whole bunch of surgeries and narrate them. And so they now have an incredible library of these virtual reality videos. And you don't have to have a virtual reality headset to watch them. You can see them in regular 2D as well. But if you have this VR headset on, you can watch the doctor do the surgery. But then if you see in this picture, you can see sort of the smaller horse's head and then a close-up of his eye. You can take a pause on that video and go, whoa, I need a close-up of that. And actually click on different parts of this horse to scroll in so you can have a better view of what that surgeon's doing it, what they're doing, and how they're doing it. So Vin, I believe, hosts these videos, and they have just a crazy cool library of these VR videos to watch so that you can learn how to do surgery or refresh your surgery It's being used pretty heavily at a lot of veterinary schools now, and they actually help the school get the VR filming stuff that they need so that the schools can film their own videos and cater them more to their own students and their own learning needs. So Pixas is going to be a fun company to watch in the veterinary space because we really don't have a lot of augmented or virtual reality companies specifically for veterinarians yet. But I would imagine the advent of all of the human medical ones, they'll be coming down the line soon. Pixas is doing just a really cool job of both promoting great education and helping veterinarians who are out in the real world. And then companies like Zapper, they actually released a bunch of resources when COVID hit and they realized everyone was going to homeschool. They did a bunch of open source workbooks for kids in various STEM topics that they can now use this augmented reality on their phone just at home for free. So both of these companies are doing some really cool things, and I think it's just that tip of the iceberg of what we're seeing in VetMed now. This is the very beginning, a couple of years from now, and I wouldn't be surprised if we have something very similar to the human world where we can wear a little headset and see our patient's surgical need sort of hovering above our patient on the table. It will really revolutionize the way that we do surgery and educate our clients, especially. So I'm very, very excited about these. And if you have kids, have them download that Zapper app, and you can look at these things called Zap codes, and they will be entertained for the entire day just playing with the augmented reality of these things. I was entertained for a very long time playing with them.
That's super fun.
Yeah, your girls would love this, I think.
I'm just thinking, oh my gosh, that set them loose on that one. That's really cool. And it's cool for me too, because I'm kind of a geek in that way. It's kind of the way it floats. I've always been like Star Trek all the way. We all the med beds, and you're just like, yeah, I want that. Can we get one of those? That would be super cool. And we're getting them.
So I'll show you actually what happened at the Veterinary Innovation Summit is they made us a coaster. And on the coaster, it has the little Zap code. And unfortunately, this one's like 3 years old now, so it doesn't work anymore.
Right.
But they didn't tell us what it was. They just said, download this app and pointed at this code. And I did that, and all of a sudden there was a heart floating in front of my face. Like the first time that happens to you, it kind of changes your outlook on a few things. It was a cool shock for sure. But there's some really cool studies showing that, in contrast to me reading about a heart surgery in a book, if I can see it in front of me, I'm going to remember it. It's going to stick with me longer. I'm going to retain so much more. So it's more important, I think, now than ever, since we have just so much data pouring at us. We have to be able to remember it and consume it in better manners than we have been in the past. So this will help.
It will help, and we're also moving out of the learn and regurgitate stage. Mm-hmm. And then now you have so much data about it, analyze it and do something with it versus just this is a heart and then take a test and regurgitate that this is a heart. I mean, you have to know what you're looking at, mm-hmm. but there's so much more data than just that now, right? Like we're kind of at the next, like you said, there's surgeons and there's robots and there's all sorts of things, but there's people who still have to do the analytical thinking and the planning versus just something Google can provide or something you can just see.
Yes.
Yeah. Well, what is that? How do we use our brains to take that information versus just memorizing the information? So, and this is cool because, like, that picture you had of all the different layers of the human laying on the table, that's Star Trek stuff, right? That's more of like, oh, we can see all our diagnostics in one place. We can see how they all interact and engage with each other versus just soft tissue versus hard tissue. And it's good, right?
Absolutely. It will really let us see the whole body in such a more holistic manner. And I would say that we'll all be better doctors because of it, but I don't know if that's true. Some computer somewhere will be a better doctor because of it, because I'm still not convinced the human brain can intake that much information and process it properly. I do think this is all going to have to be heavily supported through.
And just froze up.
Artificial noise going to need to be there to help teach the person who this is happening to. And so we as humans, as doctors, will definitely have a little bit of a change in our jobs, but we'll deal.
Just be fluid, right? Have an open mind, because like anything, there goes through stages of just rapid advancements. I mean, when computers came out, it took like a whole floor to run something that is not as strong as the phone sitting on our desk, right? Like the phone sitting on our desk took an entire, probably high-rise building to run that much computing power. And then exponentially over time, we get to like, well, why can't my phone run that? There should be that's just how it works. So exponential growth.
Yeah, I definitely had a moment. I was talking to Robert about it. I had this moment where I was out in my yard and I don't get Wi-Fi out there. And so I was downloading an episode of something to listen to while I was out watering. And I realized in my hand that I had downloaded an entire hour-long HD episode of something in less than a minute. And I had this flashback to the sound of dial-up internet and how that would have taken like 7 whole days to do before. And that's just in, a 15-year time span. And with exponential growth, we're going to continue to see this just double. And we could have the same conversation 6 months from now, and it will be entirely different.
Entirely different. Just in completely new places, right?
Yes. Which I find fascinating and exhilarating and exciting. And I feel like every other veterinarian who's out there running a practice finds terrifying, which I can't really blame them, because that's a lot of change to deal with when they have so much else going on. But yeah, that's what I get jazzed about, is finding ways to take these sort of inaccessible technologies, AR, VR, and make them accessible to our veterinarians and how we can improve their lives with them. So this will be a fun one to watch.
It will be a fun one to watch. I'm actually really excited about it. And, it's this whole COVID thing is probably putting a little oomph behind it to make it move faster, because it's the way people can learn and see right now. And so, world events are maybe encouraging that exponential growth even further on it. So we'll see.
Absolutely. It's the saying that I kind of love to hate. You never let a good crisis go to waste. Is that what it is? I kind of hate it, but I get it. Yeah.
We're learning out of everything. It's how, it's what you do with it. Sometimes you don't get to choose what's on your plate, but how you approach it and how you deal with it, that's all up to you,
Absolutely.
So I'm all about taking the high road, as you know, and finding the positive and the empowerment out of it. It put a smile on your face versus dragging your butt all the way down the hall, right? So, well, thank you, Jess. It's always a pleasure.
Thanks for having me. I always have fun.
Talk to you.